It's the 1 year anniversary of the Guam Memorial Hospital's use of telemedicine, which is all the ways that residents and their doctors can use technology without being in the same room. This method includes the use of phone calls, video chats, emails, and text messages. Clinical nurse informatics supervisor Paula Manzin.
We wanted to solve a very simple problem that we had, which was we didn't have an ICU physician. Not that we didn't have an ICU physician, but we wanted to expand our ICU physician capability here in the hospital.
Manzin said that at the time, GMH only had one ICU physician, Dr. Jolene Uggan. Since Dr. Uggan was working nonstop when the pandemic hit, they wanted to find a way to alleviate some of the workload offer, thus starting the telemedicine program. Over the year, Manzin shared just how many patients have been treated with this method.
So we have been treating many patients in the ICU. So our program started out in the ICU, and then it expanded to the ER and also now neonatology. So many patients.
For those curious about the neonatology patients, it means that newborn infants, especially the ill or those born prematurely, are treated using telemedicine as well. According to Manzin, every patient admitted into the ER will see a telemedicine hospitalist, and from there, treatment begins.
If you are in the ER and you're going to be admitted into the hospital, then you will see the hospitalist. That's a telemedicine hospitalist. But we also have on-site hospitalists that work hand in hand with the telemedicine admissionists, is what we call them, with that.
Manzin stated that the telemedicine hospitalist is always a doctor assigned to help with your treatment. She added that GMH is trying to expand the telemedicine program to offer more services such as rheumatology to help treat patients that suffer from arthritis and other diseases of the joints, muscles, and bones. GMH uses many telemedicine methods, with one being video calls.
They have a high definition camera that can see the whole room in a wide angle lens. They also have a high definition camera handheld that we could point to the skin if we wanted to go closer, or to the ventilators if they want to see the ventilator settings or any of the machines. And then we also have a stethoscope that you can put on the chest to hear the heart and the lung sounds.
Residents that were treated using this method have reported good results about the program. Daniel Perez reporting for Guam's News Network.